Thanks to you for tuning in. I'm live tonight from Chicago. Tonight's lead, will there be more cases of Ebola? Late today, President Obama meeting with senior health and national security officials, reviewing the government's response to Ebola so far. Here's what we know. NBC News confirming the identity of the Dallas nurse who got Ebola while caring for the late Thomas Eric Duncan. 26-year-old Nina Foam is isolated in stable condition. Now, officials are investigating why her protective gear failed to keep her safe. Today, the head of the CDC said that this second infection means the U.S. must rethink how we combat Ebola. And he warned, don't be surprised if more people get infected.
We have to rethink the way we address Ebola infection control, because even a single infection is unacceptable. We'll work with hospitals throughout the country to think Ebola in someone with a fever or other symptoms who has had travel to any of the 3 affected countries in the previous 21 days. We're concerned that there could be other infections in the coming days.
Also today, troubling new questions about why America hasn't yet developed a vaccine for Ebola and whether the fight over the proper role of government in the U.S. has hurt the country's ability to respond. The questions now: are hospitals ready to deal with more potential cases? Are new procedures needed to keep healthcare workers safe? And does America need to reevaluate how it's fighting this disease? Joining me now is Dr. Seema Yasmin, public health professor at UT Dallas, and Joan Walsh, editor-at-large for Salon.com. Thank you both for being here.
Thanks, Rev.
Thank you.
Doctor, what does the CDC mean when it says hospitals need to think Ebola? Aren't hospitals doing that already?
This is really a call to wake up and get ready, Reverend. We've already seen this one case in Dallas where a gentleman from Liberia had fever, symptoms consistent with Ebola, and he was discharged home from the hospital, and then he sadly died, possibly because of a delay in diagnosis. We don't know. This is a wake-up call that physicians across the country need to take that essential travel history from anybody with fever or other signs consistent with Ebola. As long as the epidemic continues to rage in West Africa, we will continue to see imported cases here in the U.S. and in other parts of the world.
Now, this nurse that has now been confirmed to have been infected has now been identified. Can you share with us any other information about her and how she has become a victim of Ebola?
So it's very hard to say without having all of the details, but we know that she's a young nurse. Her family spoke to the Dallas Morning News, where I work, and told us that she has a very big heart. She's a caring person. And Reverend, I can tell you from experience that sometimes putting on all of this gear can be tricky. Sometimes you're in a rush, you're working very long shifts, you're caring for multiple patients at the same time. So healthcare workers try their hardest, but we're human. We sometimes make mistakes. It's sometimes difficult to find out exactly what was that one incident that caused the exposure, and it may be that we never, ever get that answer.
Joan, health officials say they have things under control. Do Americans believe them?
Well, I think Americans are increasingly worried, Reverend Al, and we know there shouldn't be panic, but I think that this second case where a healthcare worker, we were at least initially told, had taken precautions, was wearing the right protective gear, the notion that she would wind up sick, it mystifies people, exactly what happened. And, the doctor's right. It seems as though there was a breach in protocol in the way perhaps she took off her gear, and all of that is important. But I think that there's a lot of worry that people don't have adequate training. We've seen cutbacks in healthcare funding, and something like 45,000 state and local public health workers have lost their jobs just in the last 5 or 6 years under just budget cut again and again and again in a lot of our states and cities. So I think people are worried about the infrastructure. They're also worried, there are lots of stories now about the friends and family of Thomas Eric Duncan who were quarantined, but they weren't given food, they were not helped, they were not even given fresh bedding for days. The cleanup of that site lagged behind what it should be. So I think people want to know that all of our authorities on the ground are prepared and doing what they need to do and are protecting us.
Dr. Seema, I saw you nodding your head while Joan was speaking, and I was reading of reports today of people that lived in the area where this nurse lived. There's real fear out there, isn't it?
There absolutely is, and there's so many questions from local residents here in Dallas about whether local hospitals are prepared. And we heard from a national survey of nurses that 85% of them did not feel adequately prepared to deal with Ebola. I visited a local hospital a few days ago. Nurses coming off the night shift said the exact same thing. But the way that their hospital responded was to say, if you're telling us you don't feel prepared, let's go over the training again and again and again until you do feel ready, until you do feel comfortable to care for a patient with Ebola.
Now, Joan, I want to go back to something you mentioned about the cuts, because the head of the National Institute for Health says America would have developed an Ebola vaccine if it weren't for budget cuts. The quote, if we had not gone through our 10-year slide in research support, we probably would have had a vaccine in time for this. And here's a chart. Adjusted for inflation, NIH funding dropped $5.3 billion between 2004 and 2013. I mean, how big of an impact has that had on research into Ebola? And could we have had a vaccine by now if we had not seen these cuts, in your opinion?
Well, Dr. Francis Collins is a very wonderful expert on this and is a very sober person. So he told this to Sam Stein at the Huffington Post. If he says it, I don't think he's given to hyperbole. I think he means it. And they have been coping with cuts. We've lived through a period of austerity, Rev, where both parties at times have looked for cuts, and they've looked to some of our health funding and particularly prevention and containment programs, which they're very labor intensive. And it might seem like, well, we're not dealing with the pandemic, so maybe we don't need this funding. But it's kind of like a fire department. Firefighters might sit around for a while, but you need that many people if there is a fire. And I think that there's been a notion that we could defund some of these programs and live to tell about it. And there's just been a mania for budget cutting and frenzy about the deficit that has certainly hurt both infrastructure and research. Absolutely.
Seema, your view on the budget cuts, has it affected the possibility of a vaccine to have been found by now?
Absolutely, and not just vaccines, but also public health preparedness. When I was working at the CDC, we had consistent cuts in public health funding. We always felt like we were trying to do more with less year on year. And preparedness is one of the keys of public health. Reverend, I can't emphasize that enough. It's the behind-the-scenes work that you do to be ready for a situation like this. And now this has happened, we're suddenly scrambling to find the right people, the right resources to send to West Africa, including the vaccine. Cuts there in medical research as well. Vaccine development can take up to 10 years and many hundreds of millions of dollars. That's a big reality check for us right now when we are suddenly demanding an Ebola vaccine right away. It doesn't work like this. This is a very brutal reminder that cuts to medical research and cuts to public health can be deadly.
Wow, and you've seen it firsthand. Thank you, Dr. Seema, Yasmin, and Joan Walsh. Thanks again to both of you for your time tonight.
Thank you, Reverend.
Thank you.
Coming up, a hazing scandal on a New Jersey high school football team. The details are graphic and shocking. And some say the teen should be tried as adults. Also, Scott Walker's duck and weave on his right-wing policies, but will slow him down. Plus, the controversial ad that's dividing the political world today. Is it offensive, effective, or both? And Beyonce, Jay-Z, and the Mona Lisa. It's an awesome overload, and it's in tonight's Conversation Nation.